Living with a mental health condition in low and middle income countries is tough due to the lack of access to services, pervasive stigma, and retrogressive cultural beliefs. Sadly, the Kenyan government spends a paltry 0.01% of annual health budget on mental health, and the total number of mental health workers per 100,000 population is 0.19. 10.8% of Kenyans suffer mental illnesses at any time, and the World Health Organization estimates that up to 80% of these people do not receive treatment. The aim of the documentary Alika is to demystify mental health by sharing true stories of people who have struggled with mental illnesses and triumphed. It articulates their stories of how they found help in the face of an 80% treatment gap and found their footing. This will help bust the myths and stereotypes of doom and gloom surrounding mental illness.
I want to use these very inspirational stories of these ladies and gentlemen who have triumphed over mental illnesses to change people's perception on mental health so that we can eradicate stigma and so that we can, as a society, normalize talk on mental health. Unless we do this, people will continue to die from suicide and people will continue to suffer from untreated and unattended mental health conditions. My name is Iregi Mwenja.
Greetings and welcome wherever you're watching us from. This is Between the Lines. I'm your host, Karanji Jackson. Issue of discussion today, mental health. With the government establishing a task force that looked at the mental health awareness and issues around the country and the surging numbers of the COVID-19 pandemic, we delve in today to discuss the whole idea of what mental health is and the issues that continue to affect our country. In studio today we have Mr. Iregi Mwenja, founder and CEO of PDO Kenya, a mental health advocate. Mr. Mwenja, karibu to the show.
Asante sana bwana Karanja.
Yes, so let us start by discussing what is PDO Kenya and what is the whole thing about it.
Okay, thank you for having me.
Yes.
PDO is an acronym for Psychiatric Disability Organization. Mm-hmm. It's a community-based organization that was formed here by residents of Nakuru. We brought two people together. These are people who are affected by mental ill health and also psychotherapists or the experts. So we decided that as the community of Nakuru, we know that there is a very huge treatment gap, and we would not sit and wait until any other person from outside come to our rescue. And therefore we came up with a platform that will be addressing some of these the mental health challenges that haven't been addressed through treatment and through advocacy to eliminate stigma. And therefore that's how PDO came into being.
Impressive.
Yeah.
Is PDO limited? You've mentioned that it was founded here in Nakuru. Is it limited to the people of Nakuru, or is it a national organization?
Well, when you're doing a good job, I think you don't get geographic boundaries. Okay. And we are able to extend our services within our country and even beyond. Okay. Because we embrace technology, and therefore we even have clients in Uganda and other countries.
Impressive. How? Yes. When was the organization set up?
We are 4 years old.
Okay.
We were set up in 2016.
Okay.
We turned 4 years this year in May.
Uh-huh.
And yeah, we glad that you're growing.
Impressive.
Yes.
So let us just delve into the issue. What is mental health?
Mental health is, when you talk about health, health is broadly categorized into two categories, the physical and the mental health. Of course, unfortunately, we discuss more about physical health more than mental health. And unfortunately, physical health is even affected more by your mental health status. So, when you talk about mental health, we are talking about, both your psychological and emotional well-being, and your ability to function in terms of work, socialize, and just live a normal life.
Mm-hmm.
So broadly, that is what mental health is all about.
Yes.
Yes.
Okay. Let's just start from here in Africa. It has been mentioned several times that issues of mental health could be attributed to either witchcraft or spiritual problems. How true is this statement?
It's an unfortunate statement because it has subjected millions of people to untold suffering. Because once a medical condition is called spiritual, it is not taken to the doctors. It is taken to pastors and other spiritual leaders. And therefore, that problem is not addressed, medically.
Yes.
And mental health is not a spiritual problem. It's a medical problem, like physical health. And therefore, it's unfortunate that we associate mental health with witchcraft, spirituality and things like that, and therefore most people who would have benefited from medical treatment end up not getting it, and in most cases the more you spend a lot of time waiting before somebody gets help, the worse the case becomes, and therefore the more difficult it will be to treat at the end of the day.
Oh.
Yes.
Well, because we often hear this, especially maybe in the estates we live in, and even with people that we interact with, and you'll hear people throw statements like, "Uyo ni mapepo, uyo alirogwa ni uchawi." So,
well, in the course of our duties, it's not. We don't get surprised when somebody tells us that he has a shortcut for how to address the case, and somebody has even recommended to us several times, in several different occasions, people recommend to us that, can you ask the family whether somebody in their lineage has finished paying dowry, because that could be the cause of the problem. You should not struggle with therapy and psychiatric treatment. That could just be sorted out, and this person would be okay.
yes.
It's very unfortunate, and I know so many people who have paid dowry for their parents and their kins who have passed on,
Yes.
hoping that it will end up giving them the relief that they want to see. But unfortunately, even after paying dowry, which was money you would have spent in the medical treatment, this person end up not feeling well, and therefore when they come to us, they have the frustration of having exhausted a lot of their financial resources on the wrong avenues. So I would advise people to, if they want to observe their culture, they should observe their culture. But remember, when it comes to medical problems, there is no other route apart from talking to professionals, and that is the only way it can be addressed. Other things can give you peace of mind, yes, which is good, but remember, prioritize medical route before you take other routes. Yes.
We'll be coming to look at maybe the different methods that people actually use in trying to release stress, as they put it. Okay. Now, what are some of the major mental issues or disorders here in our republic?
Well, in our republic, and this is the pattern all over the world, depression and anxiety is a leading condition in the world. In the whole world, we have over, I think, 300 million people who are affected by depression and anxiety.
Yes.
And in Kenya, I think we saw a report by WHO saying that 2 years ago we had about 2 million people affected.
Yes.
So putting in COVID-19 situation and the impacts, the socioeconomic impacts of it, you can say now probably in Kenya we probably would have been hitting more than that, probably 3 million or so getting affected. But also we are also you have seen in the last few years a sudden increase in the number of suicide cases reported. So that is also another problem that has that is affecting us. But broadly talking about mental health, there are very many other conditions. But I think those two have some of them the highest impact in terms of loss of life and in terms of the health impact to families, economic impact to families, and loss of productivity.
Speaking of actually suicide, the World Health Organization rates Kenya 29th worldwide in mortality rate led or caused by suicide. And day by day we witness these numbers growing, even with teenagers who at times we often think that these people are not stressed or what. What could be the reason behind this?
First of all, there has been several changes in our lives. The social aspect of it. There has been so much changes brought about by technology and brought about by globalization, and therefore these changes come with their own benefits and also they come with their own shortcomings. And therefore those changes have resulted in affecting people in many ways, especially young people, as you're saying. With social media, for example, a young person today can compare him or herself with a young person in Europe or in any other country.
Yes.
And given the stage of life they are in, for example, adolescence, that has a very, very huge impact on both their mental health and their self-esteem. So we find that, for example, girls will get very much affected when they look at other images of other girls who have what seems to be what it takes to be a beautiful girl, and therefore that definitely puts them down and affects them tremendously. There's also the economic impacts. We know that you haven't been doing very well, and that has a lot of trickle-down effect in terms of how it affects our mental health. And there is also the issue of the rising population, that we are getting more and more, but the government is investing less and less in mental health, and therefore finding help, even when somebody wants to look for help, is also extremely difficult. And therefore it's either difficult because you can't find it, or you can't afford it, or you can't access it, and therefore you end up staying with your problem. Yes.
In the 4 years that you've been working with PDO Kenya, what are maybe the main leading factors that cause mental issues in the Republic?
Well, there are several factors that would be attributed to, causing a mental health or determinants of mental health. Of course, we have factors like genetics, biological factors.
Yes.
We know that there are people who are affected by mental health because they have received those genes from their parents. And that one you can see it probably even in the lineage. You can see a certain condition happening in parents or in uncles and grandparents. But also we have the socioeconomic factors. Poverty is one of the biggest determinant of mental health. People who are living in poverty, in terms of people who cannot afford the basics, food, housing, and in some of these areas of poverty have also high income. So all these factors contribute to mental health. Yes.
Impressive. We will take a breather. For those who are joining us, this is Between the Lines, and today in studio we have Mr. Iregi Mwenja, a mental health advocate, founder and CEO of PDO in Kenya. We are discussing mental health and the need for mental health awareness in our republic. Don't switch the button. We'll be back after a short while.
My name is Leslie Shiruha, and I'm a counseling psychologist by profession. I am here today for our weekly prison visits, where we do counseling to the inmates.
We started a psychosocial support for inmates at Nakuru Women Prison. Soon, we realized that inmates who are released struggle with re-entry back into society, greatly jeopardizing the gains made during their rehabilitation in prison. A mixture of overwhelming joy and anxiety accompanied the release of an inmate. Most of them do not know where to start. They need somewhere to live, work, and support to reintegrate. But for some, this was a daunting challenge. Working with Kenya Prison Service and with support from the French Embassy in Nairobi, PDO initiated a pilot social integration project that combined psychological support and socio-economic empowerment. We were able to train 107 inmates on restaurant service, soap and detergent making, business and entrepreneurship, life skills, and baking and pastry. 16 ex-offenders received financial and material support to secure a job or start a business after their release from prison. 2 years later, the livelihoods created continued to thrive, and there has been zero recidivism rate among our beneficiaries. The greatest lesson we learned was that prisoners want to change, but the society is ill-equipped to support them.
Welcome back to Between the Lines. Today we are discussing mental health and mental health awareness in Kenya and in the world. In studio today we have Mr. Iregi Mwenja, founder and CEO of PDO Kenya. Thank you once again for being here. From the short clip that we've watched, you had a visit to the remand prisons.
Okay, Bwana Karanja, we have, over the years, actually PDO became known for working with vulnerable populations, and prisoners was one of them.
Mm-hmm.
And in 2017, we started a project at Nakuru Women Prison,
Mm-hmm.
in which we looked at providing psychosocial support.
Mm.
And in the process, we realized that these women are in prison, but actually, as they serve their term and rehabilitate, one of their biggest headache is how they'll go back home and how they'll integrate back into the society. Mm-hmm. Given the fact that most of them, come from, have been arrested because of selling changa or things
Mm-hmm.
like that,
Mm-hmm.
and they are not going back to the same trade because they don't want to go back to prison.
Mm-hmm.
So we realize that as much as we give therapy to them and we try to calm them and help them to adjust to prison life,
Mm-hmm.
they were not able to have that peace of mind until they knew what would happen to them when they came out. So we started a project in which we did life skills and vocational training, and prepared them for going back to their community to start life afresh. In terms of they will not go back to the trade that was illegal, they'll start a new trade, and we give them a small support, small capital to start a business. And we continued with providing the psychosocial support even when they were out, and ensuring that they continued to thrive. And we were happy that, as you see in that video, we were able to record. We have so far not recorded anyone who has been rearrested for committing a crime, which is a good success rate.
Yes. Very impressive. Actually, now, that was my next question.
Yes.
We have witnessed, as we have seen in the clip, those success stories.
Yes.
My question was, are there any failure stories?
For that particular project, I think the greatest measure of success is that these people are able to integrate and thrive and turn away from any illegal businesses they were involved in before they were arrested. So I think that would be the best measure of success. And obviously, sometimes there are those who will have challenges. Sometimes you may start a business and it doesn't turn out as you wish, because of course we were giving a small financial boost, not a lot of money.
Okay.
And we know all businesses that start, not all of them succeed.
True.
So some of them would have difficulties breaking even. But at least they never went back to crime, and they had been trained on other skills, so they would also seek employment. Those who started what they had been trained on and failed went into employment.
Okay.
Yes.
Allow me to build on that. We've talked about the offenders, the prison women that were in prison. Did your project also go to the families of these affected women?
The reintegration process is complex. It's actually not as simple as I put it.
Okay.
It was one of the most challenging aspects of that project, because once somebody commits a crime in our society, we stigmatize them, and even families want to disown them. So we had some cases where the families had disowned them, and some of them, one particular case, the family had said, the only thing we would wait for you is to bury you. We don't want to see you again. So it was one of the most challenging the case we handled. So 6 months before you're released, we visit your family and we start taking your message home that you have been under rehabilitation, and we have seen what you're going through and how tremendous the change has been, and the fact that you're asking for forgiveness, and asking your family to take you back when you come home. And we would do that, do several visits, and then ultimately bring the family back here to prison. And with the help of the management, they would have a one-on-one session, which is not a very common, but they would have one-on-one in the same room, and now exchange their reconciliation, and the whole process guided by a therapist. And it ended up very well. It was one of the most amazing stories that we had from the prison.
Yes. For those who are joining us, this is Between the Lines. Today we're discussing mental health and mental health issues in our republic. Send in your comments on our Facebook, YouTube, and Twitter page. The hashtag is Between the Lines Mental Health Kenya, Nakuru TV. Mr. Iregi, let us discuss about mental health in the context of it being discussed. Why do we not have enough discussions on the topic of mental health?
I think it's a good question, Bwana Karanja.
Yes.
We, as Africans, do not, first of all, consider one organ of our body that is the most important organ. We don't think it can get sick.
Yes.
So if you look at our culture, if you look at most of our African culture, there's no culture that has a medical name for depression or any other condition. Anything that happened to you that we know today is mental health or mental illness was associated with spirits and witchcraft and demons and all those other things. So those were not medical conditions, and that is why they don't even have names for all those. No one has a name for depression in any tribe.
Yes.
So we still have a lot of that influence in our culture today, and even people educated to even in Western world, as long as they are African, they'll still have an element of them that believes that mental health is something to do with demons and spirits and curses. And as I mentioned earlier, how somebody having not paid enough dowry or finished the dowry payments and things like that, cultural issues. So the moment we treat mental health as a cultural issue, then people don't want to talk about it because we fear and we don't want to be associated with those kind of problems. Yeah. Otherwise, if we treated it as a medical problem, we would be very happy to talk about it the way we talk about cancer, the way we talk about diabetes and other conditions.
A day ago, the government received a report from the task force that was set up by the government, actually by the President, Uhuru Kenyatta. And among the recommendations by the report was that it was time that the issue of mental health be declared a national emergency. Do you think it's timely, or are we too late?
Well, It should have happened yesterday, but it is not too late.
Okay.
It is a step in the right direction. Since last year, we saw some quite encouraging signs coming from State House. You know, for the first time, we had the president talk about mental health in a national address during, I think, Madaraka Day last year, or one of, I think, Madaraka Day. And by the point he directed the minister to form the task force, it was quite clear that State House is quite up to date on mental health situation in this country. So that is a very encouraging development. But on the other hand, we still need to remain vigilant, because we know the history of task forces in Kenya and their report. Very good, but implementation is where the challenge is. So I don't know what will happen to this mental health task force report. I'm hoping it will be the first one to be fully implemented.
Still at the same, during our research, when we were preparing for this, we found out that the budgetary allocation under the Department of Health, specifically under the section of mental health, is 0.5% of the entire amount allocated to the Ministry of Health. Do you think that this poor or minimal allocation could play a part to having a surge in mental illness issues?
You know, you can't get results in something you don't invest in.
Yes.
So you should not be surprised that we are having all these problems. The previous budget, not the current one, but the previous budget, you know, 0.05, I think, percent was coming to around 156 million shillings of the health budget, which was around, I think, 60-something billion shillings. So if you look at that, what does that tell you? You know, mental health is the least prioritized medical condition in our country. And therefore, no wonder a lot of people are getting, you know, we're losing a lot of people to suicide, and we're losing a lot of productive young people to substance abuse, to, you know, missing work because you can't go to work, you have depression or you have other conditions. And, you know, looking at it globally, the world loses about $1 trillion US to mental health conditions. And if you look at the losses in terms of productivity, there are things we call DARI, you know, the disability adjusted life years.
Okay.
You know, mental health is one of the biggest contributor to that. But we still don't invest in it, and therefore the consequences is of course clear that we'll end up having all these losses. Yeah, as an economy and in terms of human suffering. Yeah.
Actually, because as you've mentioned, the pressures of life actually could be playing a part in issues of mental health, because right now we are witnessing a pandemic that has hit the global sphere.
Yes.
We have numbers increasing by the day, and actually the Health Cabinet Secretary Mutahi Kagwe actually mentioned that the surge in numbers and the economic situation of our republic could be playing a part in the numbers of mental health issues witnessed in our republic. Well, I beg to ask this question. Over even before the pandemic, in the past maybe 3-4 years, we have and we continue to witness cases of both suicide and homicide by different members of the republic. And I would want us to look at one particular group, that is the members of the security forces, both the police and also the armed forces, Navy and others. Time and again, you will hear of a police officer who will shoot the wife and the kids, and also maybe turn the gun to himself or herself. Do you have an idea? Is it the pressure of the work, or is there something that is not being done?
First of all, when you come to professions and how they're affected by mental health, research globally shows us that you know, people in combat, for example, people deployed to Somalia or to Iraq or whatever, usually suffer one of the highest prevalence of mental illnesses. They're followed by people like prison warders, and the police, and other uniformed cadres in that order. And it has a lot to do with the kind of work they do and the conditions at work. For example, we know that our police do not have some of the best working conditions.
Yes.
And they're not just the housing and the
Financial.
and financial, but also relationship with your bosses and the structures and the stringent way that the bosses want to manage their staff. You know, they are not employing human resource, greatest human resource strategies that would help their juniors feel comfortable in working for them. So some of them you have seen, it's like revenge and things like that. But also, on the other hand, we should also not forget that a police shooting a boss or a wife or a girlfriend will get headlines. But an average person, spouse killing the spouse, may not get as much headline and attention.
Yes.
And therefore, sometimes also they also get more attention because the media also focuses more on those cases. But they are also happening in other professions. Even doctors are some of the most affected also due to the nature of their work. And today, because we are having a new problem, the pandemic, the health workers who are working at the isolation ward are also some of the most affected in terms of their mental health. And luckily here in Nakuru, PDO has already started doing interventions, and we have conducted 4 sessions in Nakuru National Park and at Menengai Forest. And we will continue to offer them the support they need so that they can be emotionally and psychologically fit to do their work and continue protecting us from the pandemic.
It's good that you've mentioned that not only the members of the combat forces, but even others. Now, in your experience, having worked with maybe members or people that have had issues of mental health, there was a case of where a woman lured her 4 children to her bedroom and strangled each of them and covered them with a blanket. It was tragic. It was not the best of things to witness or see. My question is, are there people that will resort to maybe such acts and yet they had not shown the symptoms of mental illness?
Okay, I think at this stage it's good to also talk about something that happens all the time, and this continues this narrative has continued the stigmatization of mental health, you know, and demonization, if there is any such a word, of mental health. There is criminality and there is also illness. And it is always difficult to draw a line because that person would have to be assessed. But also let's not forget that there are criminals who do criminal acts and they don't necessarily need to have a mental illness. Unfortunately, in our society, if you commit a horrendous crime, you are branded as having a mental illness. But if you commit a crime like a bank robbery where you even kill people, or corruption where you steal billions that end up making people suffer and lose their lives, more, you're considered a hero. So let's not just paint mental health in terms of just bad actions and bad things that happen in the society. It could be a contributor, but it is not the only contributor, and it should not be used as the only way to interpret a bad situation. You don't understand that person, yes, what they did, because you're not in their shoes, and they may not necessarily have had a mental illness, but they could also have had a mental illness. Yes.
I'm glad that you've mentioned that. Now, please, maybe being a specialist or a professional, would you explain to maybe the people who are watching why would a person who commits murder always asked to have a mental evaluation? Is it because they feel that maybe this person may have something in his mental, in his brain that could lead to that? Actually,
I think it's a requirement by law that capital offenses, anyone that is being charged with a capital offense, they need to have their mental status assessed. I think it's a requirement by law, but also it would be good practice to have everyone who is undergoing trial to have their mental status assessed. It wouldn't harm if you knew what status they were in when they did the crime. Yes.
Because actually a statistic by the government of Kenya indicates that 1 in every 4 Kenyans does suffer from mental health at one point in their lives. As I was reading this, I was asking now, and I would maybe ask you to help us here. Does this mean that an individual may have a phase where he or she suffers from mental health, then move to another phase where the mental health goes away?
Okay. It's a good question, and I'm smiling because we have a lot of ground to cover in terms of awareness on mental health. A mental health condition, an illness, is not necessarily lifelong, isn't it?
Yes.
Just like other physical conditions, there are malaria that can come only for a week or so, but there is diabetes that you can live with for your entire life. So it's just the same scenario in mental health. And therefore, somebody will get depression for 3 or 4 or 5 weeks, and they recover, either by help. Mostly if they get help, they can recover more quickly and probably not get another episode of depression. Remember, some of the common causes would be life circumstances. For example, if you're going through divorce, if you've been fired from work, like there's so many people who are losing their jobs through this pandemic.
The pandemic.
And yeah, we are seeing in our daily, intakes, people coming for help, that has, I think, tripled or quadrupled in the last two months. So yeah, so those people will be treated, but if they get another job, they will recover and most likely not necessarily go back to where they were. Yes.
When we come back, we'll be discussing about the different ways that people deal with depression and anxiety and other mental illnesses. And then you'll tell us how alcohol and drugs can be used or cannot be used in dealing with mental issues. It is a special show, Between the Lines, and we are discussing mental health awareness in our republic. Please keep sending in your questions, comments, and suggestions, and we will sample them as the show goes on. One nominated Senator, Kasanga Sylvia, once quoted that there is no health without mental health. We'll take a breather. When we come back, we wrap up the discussion.
Research by the World Health Organization showed that half of all mental illness begins at the age of 14, but most cases go undetected and untreated. PDO schools' psychosocial support programs target teenagers and young adults in secondary schools and colleges because we understand that undiagnosed, untreated, or inadequately treated mental health conditions can affect a student's ability to learn, grow, and develop. It could result in major problems such as chronic absence from school, low achievement, disruptive behavior, and eventually dropping out. The impacts of our psychosocial interventions includes enhanced academic achievements, improved self-esteem, enhanced respect for diversity, and decreased oppositional behavior.
Welcome back. I'm glad you stayed tuned. It's Between the Lines, and today we've been discussing mental health awareness in Kenya and in the world. In studio today we have Mr. Iregi Mwenja, mental health advocate, founder and CEO of PDO Kenya. I'm glad that we keep getting feedback. People are enjoying the show, saying that it's an informative, insightful discussion. We have one question. Yes. From one Naomi Njeri, who says the topic is timely and would want to know what is the difference between a psychologist and a psychiatrist.
Okay, well, a good question. A psychologist and a psychiatrist, these are both medical professionals that are they play a part in treatment of mental health condition. A psychiatrist is a medical doctor who has specialized in psychiatry. So they'll give treatment, and mostly they do the assessment, diagnosis, and they give drugs. When they do that, this patient will require another component of treatment, which is called therapy. So in therapy, the patient is assisted to deal with the issues they are having in their lives, as the medicine deal with the issues in the body. So the psychologist now comes to give talk therapy or other forms of therapy to aid in the recovery of the patient. So the two of them work together, very closely work together. Yes. And in some cases, some mild cases cannot be handled by just a psychologist through therapy.
It will need the input of both practitioners.
We say that mild cases, for example, if you have mild anxiety or depression, you don't need to see a psychiatrist. You can, it can be handled comfortably by a psychologist or a therapist. Yes.
Well, the government wants to declare it a national emergency. Kenya, at the moment, stands with only 88 psychiatrists, 427 psychiatrist nurses who are trained to handle mental illness, and about 10 medical social workers and a few mental psychologists and counselors who are competent to handle mental issues. Is this number too little to handle the problems of the entire republic?
If you look at the figures the government has given of one person in every 10 going through a mental health condition at any moment, and 1 in 4 will have a mental disorder in their lifetime. That tells you, for example, 1 in every 10, we have 4.7 million people who have one level of mental illness or the other.
Yes.
They don't necessarily need to be seen, all of them, by a psychiatrist or be admitted, but they have a problem that needs to be attended to. Yes. So 88 will not necessarily be able to handle the entire number. The 400 and something nurses will not be able to handle that. The psychologists, I think a few thousand psychologists, will not also be able to handle that at the moment. So this is not a situation unique to Kenya. This is also a problem in low and middle income countries. And therefore, the World Health Organization has come up with a strategy to help us bridge the gap. We have probably in Kenya over 80% of mental health conditions, or people with mental illnesses, do not get any form of medical attention. And therefore, to bridge that gap, we cannot now say that we need to take doctors to hospital and wait for 6-7 years before they can graduate as psychiatrists. Between those years, how will we have handled the problem and the consequences of COVID-19? Yes. So the easier way to handle these at the moment is to do what you call, WHO calls, task shifting. Okay. And this has happened in other medical procedures, like when grandmothers were trained as the midwives in the villages, and this helped a lot to give us safe deliveries when people could not access hospitals. But also we have seen in Zimbabwe the same case, grandmothers are being trained as lay mental health counselors. And PDO has also adopted the same strategy, where we are working with the community health workers and people with lived experience and training them as lay mental health workers. So they will deliver certain certain level of interventions, like counseling, basic counseling, like problem-solving therapy and all that, and help you alleviate your problem because, as I said, most problems when they are starting, they can be addressed at the grassroots, at the community level, and they don't need to be taken to the hospital or to psychiatry units. So if we train more people, like we do a 1 week training, we will help alleviate the shortage in the short term, but also we should invest more in training the specialists and equipping them with the facilities, because remember we have a unit here in Nakuru that has 20 beds, and today I think around 78 patients squeezing themselves in 20-bed facility.
Yes.
So we need to invest more also in facilities as well. Yes.
While investing in these specialists, do you also think that there should be more creation of more awareness about mental illness and mental issues among the Republic, the people of the Republic?
PDO has actually, in the last 2 months, we've been doing what you're calling consultative meetings with all stakeholders and asking them what do they think is a priority for mental health. And actually, we found that an overwhelming majority of people in Nakuru believe that the number one priority is, first of all, to create awareness. You know, when you create awareness, you fight stigma. People are aware of what mental health is, and when they have symptoms, they may be able to recognize they have symptoms and therefore go for help. And they are also able to know, when I have this problem, where are the facilities? Who can I talk to? So people have prioritized that. So therefore, it's very important to do the awareness. Then secondly is, of course, making mental health services available at the grassroots. Not everybody is able to come from Kuresoi to Nakuru Level 5 hospital, for example. The cost of transport itself would be prohibitive for most mwananchi wa kawaida. And therefore, if we had somebody trained in Kuresoi, this person can just walk to this to this community health worker. They'll be given some interventions, and most likely they will be able to handle the issues at that level. Yes.
Now let us talk about ways of dealing with mental issues. Well, we have that one about talking to professionals and others. Time and again, this can be, you can even hear it in normal conversations among people, that whenever I am stressed, I'll just drown a beer and I'll be okay. Whenever I'm stressed, I'll go and sleep and I'll be okay. Whenever I'm stressed, I only need to smoke 1 or 2 and I'll be okay.
Some of what you're mentioning are called maladjustive behaviors, the wrong approach to solving a mental health problem.
Okay.
Because a mental health problem is, of course, in most cases, already some imbalances in your brain chemistry. And the moment you introduce another chemical, alcohol, will go and mess up with the imbalance even more. Okay. And therefore, if, for example, you had depression, you'll only get a temporary relief because probably when you take alcohol, you feel sleepy and probably you sleep for a few hours. But then tomorrow morning, your depression is worse, and your financial problem is also worse, and therefore your problem gets more compounded. Okay. So those are not the best ways to handle your emotional, psychological problems. There are better ways to do that, and there are self-help strategies that you can use at home. You don't need to go to anyone. So, first of all, there are things like meditation, for example. You can do meditation at home that can help you calm, and you'll have no effect on your financial, on your pocket, or tomorrow morning you wouldn't feel a hangover. There are certain things you can do, like exercises. You can listen to your favorite music that has a calming effect on you. You can dance. You can do a lot of other things that can help you and try and address some of the problems you're going through in a more effective way that has no negative consequences. Yes. And if those doesn't address the problem, then you can always talk to us at PDO and we will give you a specialist to help you. Yeah.
We shall be looking at that. Some of the comments are coming in. A lot of people are enjoying the show. They're saying it's very informative and insightful. Kiare Paparazzi Waweru from Gilgil is watching and is excited to watch this. Ngina Kenya says, great job you are doing, especially in the prisons. Impressive. And now, so you have rolled out using of alcohol to alleviate stress And also, what about talking to someone?
Yes, yes, those are some of the things I was saying you can just do at home, you know. You can call your best friend or somebody, a confidant, somebody that you can talk out your issues to, and they'll listen to you, they'll be non-judgmental. The listening part is the most important, not even offering solutions. So talk to someone you trust. If you don't have someone you trust, as I said, you can always talk to us, and we'll give you somebody who will listen to you and offer the help that you need. But when you say alcohol, I've never seen anywhere alcohol that has been recommended as a medical solution to any health problem. So you should limit the amount you take when you have stress, because it only makes it worse. And remember, what I've learned up mtaani, when people have stress, actually, stress is actually depression. When they come and tell us we have stress, when you do the assessment, you end up finding it's actually depression. So when you have depression, when you go to drink, it will not sort it out. It will make it worse. And at the end of the day, you'll end up with two problems now, bigger problems, addiction and depression. And that compounds your life. You know, it makes your life very difficult. So instead of going that route, go the other route where you can talk to someone, you can go to your provider, if you have a psychologist or a psychiatrist or somebody to help you, you know. Use the right way, don't take drugs, because drugs will have the opposite effect.
Comments are still coming in. Celine Kidogo Mujomba says that I think the first step is for people to acknowledge and accept that mental health is an issue and seek treatment, or better yet, open up. However, the cost of treatment could be generally high, taking the fact that medication could also be high. Is that also another problem that we are facing as a people of this republic?
I would say yes and no. First of all, most people, when they call us, the first question they ask, how much are you going to charge? There's a certain mental, I think, block where people imagine, if I go to ask for mental health services, it will be very expensive. To some extent, very true, because I know there are psychiatrists here charge between 2,000 and 2,500. Psychologists charge almost the same rates. In Nairobi, it is 5,000. So, of course, if you look at it that way, you can say it's expensive. If you are looking at it from a mwananchi wa kawaida perspective. But on the other hand, the organizations that PDO, for example, we came in to bridge that gap. We appreciate the fact that not everybody can afford 2,500 to consult a psychiatrist. But remember, everybody can get a mental health condition. So to make sure that those people who cannot afford and who are in a difficult position and need help, that they get the help they need, PDO formed an initiative, we call it Pamoja, where you can approach us and come, and we will try and work with you and help you in your recovery, you know, provide you with services, make you or give you a psychiatrist to see you, a psychologist to help you with therapy, and provide you with social support and ensure you recover, you fully recover. Because we say that you don't need to be rich to be treated for mental health conditions. All of us deserve to be treated. It's actually a basic right that we have in our constitution, but the government has always neglected. Yes.
It would be important to know, should an individual seek the services of PDO, where can we get you? How can we talk to you?
Okay. First of all, I would just like to point out a few things we are doing so that people can know, you know, who we are and how, when to get in touch. PDO, we have currently we are running COVID-19 pandemic mental health response project, in which in March we started a dedicated line for people who want help on mental health issues when the lockdown started, and we have been delivering e-therapy, you know, through phone or through video, Zoom or WhatsApp video, to people from wherever. And in this case, we handled most of those cases because they came from very deserving cases. We handled them free of charge. But of course, we also look at how much you can afford to pay to ensure that also the people who deliver these services also can also get something, you know, they need also to be paid for what they do. Yeah, but On the other hand, we are also going out of our way to look at the people most affected by this pandemic. And we have been working with the COVID-19 isolation ward health workers. We've been providing them with services. And in the coming month also, we are launching a project that we will be, a mental health machinani kind of project, where we'll be going to the community with a whole fully functional not medical, but a mental health unit, which in our world we call it a well-being lounge, not a clinic, where we will have the facilities of telepsychiatry. We'll have a nurse, a psychiatric nurse on board, and a psychologist on board. So if you need to be seen by a psychiatrist, you will be seen in that van at your doorstep. If you need therapy, you'll be provided with therapy in the van at your doorstep. If you need a prescription and all that, whole system will be able to provide you with that and ensure that we make mental health accessible at the grassroots. And in this case, we are talking about low-income areas, not the other areas.
High-end and suburbs.
Yes.
So, as we conclude, so the government, among the recommendations under the report was that we declare mental health an emergency. So, do we declare it a national emergency? And number two, what does that mean in the fight, in the trying to raise awareness about mental health?
Very quickly, I forgot to mention that if you want to reach us, we have a number which is 0774 354 618, and our office at the moment are based at Love and Hope Center, just adjacent to the dog section at section 58. And of course, if you want to reach us, you can also check our website, www.pdokenya.org. And Facebook, we are Psychiatric Disability, Facebook / Psychiatric Disability. And on Twitter, we are PDO Kenya. So you can reach us through the social media platform or through coming to our office or calling our line, and you will get the help that you need. And nobody should feel intimidated by this idea that mental health is very expensive and it is inaccessible. We have never seen anyone who came to us and left unattended. And therefore, anyone who deserves help should talk to us, and we are sure that we will help them. So in terms of the national the emergency, it's an important step if the government will declare. This is a recommendation by the task force.
Yes.
It is an important step because for once there'll be more discussion on the issue of mental health. More resources will be put into the Department of Mental Health, and our energy and our focus will shift more to mental health, unlike before when we really had we've had a very minimal discussion and minimal investment in mental health. So this would be a right step that the minister and I think the president can take if they do that.
Impressive. So we look forward to interacting with you more, because the issue of mental health is an area that I feel should be given enough attention and enough insight. Should we get to the place that we now declare it an emergency, I think we will go back and now introduce you again and ask you now to tell us now what awaits.
Yep.
So we will play a documentary by your organization. Please tell us about the documentary.
The documentary is called Alika, and as the name suggests, Alika is a documentary that is aimed at telling people what mental health is all about, and that at PDO we are welcoming you. Alika is a Swahili word, welcome. So we are welcoming you to come and get help and thrive with us. So we used 4 very strong advocates who have lived with various mental health conditions, and they have triumphed. They are doing very well professionally. And as you're going to see, mental health should not be a reason why you shouldn't be what you ever wanted to be.
Okay.
It is just like somebody with diabetes. They'll also continue with their career or hypertension or any other condition, as long as you take your medication or you follow the advice of your doctor. So I welcome the viewers to take a look at the documentary. Yes.
We've been having Mr. Iregi Mwenja in studio, CEO and founder of PDO Kenya, an organization that deals and attempts to address the issue of mental health in our republic. This has been Between the Lines. I've been your host, Karanja Jackson. Until next time, stay safe and thank you.
Living with a mental health condition in low and middle income countries is tough due to the lack of access to services, pervasive stigma, and retrogressive cultural beliefs. Sadly, the Kenyan government spends a paltry 0.01% of annual health budget on mental health, and the total number of mental health workers per 100,000 population is 0.19. 10.8% of Kenyans suffer mental illnesses at any time, and the World Health Organization estimates that up to 80% of these people do not receive treatment. The aim of the documentary Alika is to demystify mental health by sharing true stories of people who have struggled with mental illnesses and triumphed. It articulates their stories of how they found help in the face of an 80% treatment gap and found their footing. This will help bust the myths and stereotypes of doom and gloom surrounding mental illness.
I want to use these very inspirational stories of these ladies and gentlemen who have triumphed over mental illnesses to change people's perception on mental health so that we can eradicate stigma and so that we can, as a society, normalize talk on mental health. Unless we do this, people will continue to die from suicide and people will continue to suffer from untreated and unattended mental health conditions. My name is Iregi Mwenja. I'm the founder and CEO of Psychiatric Disability Organization.
Iregi left a well-paying job as a country director of an international NGO to pursue mental health advocacy work. However, for Iregi, this was not just professional but personal. Growing up, he was traumatized by the numerous social challenges stemming from an undiagnosed attention deficit and hyperactivity disorder, ADHD.
I was born a healthy boy to a loving father and mother, but as fate would have it, things did not remain this good for long. At 4 years of age, I joined what I call the 5% double tragedy club. I joined other unlucky kids who lose their parent, and when I lost my beloved dad, and the same year I came of age for an ADHD diagnosis, which makes 5% of kids globally. And I started officially my 30-year-long journey with undiagnosed ADHD.
My name is Cynthia Ambwa. I'm a mother of 2.
Cynthia called PDO after 2 failed suicide attempts. She wanted support to buy bipolar medication as well as fight an alcohol addiction that was messing up her health social and professional life. Her family had given up on her and had shut the door on her. Due to frequent absenteeism, she was now facing imminent dismissal from work.
I had severe depression for the longest time and I did not know. So it all started with the issues in my life. I went through some very hurting experience. I went to marriage and then it ended up having domestic violence. After that, my mom died of cancer 3 weeks after I'd left my marriage. And we went through a grueling divorce period of child custody that it took me through a lot of issues because even at that time I had my career to focus and concentrate on and also to raise the children. So I didn't even have time to think of where I was or what was going on in my life or what was going on inside me. So it just started with just getting tired, feeling hopeless, feeling I didn't want to do anything, to wake up, to even just go to work. And then I got also in some severe insomnia. I couldn't sleep. So I would take a glass of wine. And you know when you take a glass of wine, today it becomes 2, and the next day it's 3, then you go to the hard stuff. So it was so bad because I couldn't deal with the antidepressants. So what I did, I continued drinking and it became quite traumatic. Many of the times I would not wake up, I just have the drink under my bed and I was crying out to God because I was feeling I'm struggling and I'm slipping away and I'm going to die.
Have you ever thought of what madness diagnosis can do to your life and to your health? My name is Iregi, a bipolar survivor.
Irene first contacted PDO after she discontinued her studies at Kenyatta University due to a condition known as bipolar that was spinning out of control, which had been misdiagnosed as depression for years and treated as such without much success. Things had turned for the worse when her father was diagnosed with cancer and her brother, who was drinking heavily, had become suicidal.
Earlier on I had been misdiagnosed with depression and treated for quite some time, but it was not working because actually I was being treated for the wrong illness until I came to realize I have bipolar. And before I even realized that bipolar, my life was really a mess because no matter how much I looked for help, I couldn't get the help, and it was getting a bit crazy. But after I learned about bipolar, life has been good and life has been better. But I'll take you back to the story of by the time I learned I had bipolar, I was depressed. That made me discontinue school. I discontinued my studies at the university, Kenyatta University, because my concentration was low. I couldn't control my moods. I was either too happy or too sad. I would get suicidal at some point, so it was really crazy. My mind was like running. I didn't know exactly what was going on. So I discontinued school. Then my lowest point was at some point I had family issues. I had a brother who was drinking. My dad was diagnosed with cancer. And still I was struggling with an illness I didn't know anything about. So at that point I knew I needed help, and because my world was crashing.
My name is Jackie. I'm 32 years of age, and in the year 2017 I discovered I have bipolar disorder. So my life has been a journey. I've been a happy girl since birth, and jovial, you know, the kind of girl that people would want to associate with. I was and I'm still the life of a party, and I had so many friends. And in 2017, towards the end of 2016, that is, my behavior changed. I withdrew from people, and after withdrawing from people, I never used to be this girl that was the hype of the party. Though I would show people that I'm good when they talk to me, but initially I was withdrawn. And within no time, I kept to myself so much that I did not get out of the house. I stayed a week without going to work. And at that time, my sons were living with me because initially before they had been taken by my mother-in-law. So when they came back, I decided with everything that was going around me, the debts, because right now I was living an extravagant life that I could not be able to manage. But now I was in debt. And I recall I went to a hotel and I tried to kill my kids, literally. And I made a concoction of poison for my sons to take. And then my plan was my sons take the poison and then I'll commit suicide.
I was a typical ADHD kid. I was labeled, I was punished, I was isolated. These experiences made me hate school, my mom, and generally my miserable life. Nobody understood what I was going through. They didn't know I was as frustrated as they were, if not more. But an inner voice always told me I was destined for bigger things in life, and this gave me a glimmer of hope.
As an adult, he chose not to allow the trauma poison him with hate. Rather, it gave him a personal sense of responsibility, love, and care for people, especially those going through similar challenges. Instead of mourning his adversity for the rest of his life, he decided to turn his pain into an opportunity to help others by registering the Psychiatric Disability Organization, PDO Kenya, a peer-led mental health charity delivering free community-based services through a social innovation model called Pamoja Initiative.
I decided to prove the naysayers wrong by working extremely hard in my academics. Luckily, I did well and I trained as a conservation biologist with 3 degrees under my cap. I had a good job and a high-flying career, but it wasn't giving me the fulfillment that I wanted. Naturally, when I finally received my ADHD diagnosis after my 35th birthday, my life got a new meaning. They say what doesn't break you makes you stronger. I knew what I wanted to do for the rest of my life. I never wanted any other child to live for 35 years with an undiagnosed mental health condition. I'll go through the suffering I went through due to lack of awareness and lack of services.
This time, I started feeling it's time for me now just to go because the medications were not helping. The society has expectation. I'm a woman, I'm a mother. There was a lot and everyone was looking at me, my family, like I'm actually being irresponsible because what is going on? When they expected me to fall, I did not fall. So no one, even I myself could not understand. So in those feelings of hopelessness, I remember I started reaching out. I'll go to Facebook and at times people use that as a therapeutic platform. I'll post all these kind of things. So one day I saw one of my friends has posted issues on mental health and I was quite attracted to it. So I started engaging him in conversation and he told me about the Psychiatric Disability Organization.
PDO gave her psychological support and she started the reconciliation process with her family. For 8 months, PDO stood with Cynthia during her struggle with depression and addiction. Finally, she accepted to check herself into rehab with the help of her employer. Today, Cynthia is 10 months sober and is adhering to her bipolar medication. Since coming out of rehab, she has not experienced any relapse. She reconciled with her family and her boss at work is pleased with her amazing recovery journey.
It was one of the most amazing experiences in my life because I went through the program, I internalized it, I got to understand the conditions that I had, I got to understand even bipolar comes because of trauma and at times even genetical because I went through counseling, they took me back even to my childhood and the issues that I had not dealt with, I was able to deal with and the ones that I couldn't actually handle it. That particular time, I was able to have the serenity, just to accept these things are like this But now, at least now I know my triggers, I know how to balance my life, I know what I want, I have my controls, and I can say it's amazing.
Personal problems compounded by the family problems triggered a severe episode of depression that was not responding to any medication as a result of the wrong diagnosis. Unable to bear the pain anymore, she finally made the 160-kilometer journey to Nakuru to be seen by our psychiatrist. She was put on a new treatment regime and given a therapist to walk with her through her recovery.
So that's why I reached out and I sought help in Nakuru. That's the point I met a psychiatrist, and the psychiatrist was able to pick out the point that I was actually being treated for the wrong illness. I had bipolar, not depression.
Within 4 months, she had fully stabilized and was readmitted back to Kenyatta University to finish her bachelor's degree in psychology. She is graduating this year after bipolar had temporarily halted her dream for 8 years. She now spends her time offering counseling services, in most cases, to people in distress but who cannot afford a therapist.
So I were it not for the intervention that I got, and I learned that I had a different condition from what I had been treated for nearly around 7 years without getting any help, without getting any improvement, I wouldn't be where I am, and I wouldn't be a success story of you can live with mental illness and still function normally, and as long as there's adherence, the life changes, and you're able to control your life and everything, and you can be happy, you can enjoy life, and life can make more sense. For me, it has been an awesome journey after learning that I have bipolar, because now you're able to learn you're bipolar, so you know the pros and the cons, you know what to do, what not to do, what to engage in, what not to engage in, and you no longer have the dark moments and the extremes, the extreme happy and extreme behaviors, or the low side of depression and suicide and everything. It's like you reach an equilibrium, your life gets a balance. You're able to balance and be like anybody else. Even if you met me in the streets, you wouldn't quite pick that I have a mental illness or I have a condition that I live with, because it's under control. So anything is possible, and mental health or mental illness is not the end of everything. It's just the beginning of a new life and a new journey.
And it took me around 2 to 1 month and a half of accepting I have bipolar disorder. Then I had to conform and accept I have it. And when I accepted I have bipolar disorder and got to know what bipolar disorder is, I did researches of what bipolar disorder is, what is expected of me. And I worked together with my doctors towards my medication, the exercises and everything, and my family was brought on board as my support system. I thank God my employer also came on board to ensure that I get good medical care and that I'm able to function at work. And I gave myself that courage and confidence to live my life. Then I also realized the stigma that goes with bipolar disorder. And I decided to be an advocate of mental health. And I started reaching out to people who have bipolar disorder and other mental health disorders, and just giving them a hand and walking with them the journey is also a healing process for me, and empowering them and also making them walk the journey with others.
These brave ambassadors of mental health contacted PDO Kenya during their lowest moments and received professional help they needed to recover. Today, their careers are back on track, and they are proud to share their stories with the world so as to motivate and inspire others. Most of all, they want to help eradicate that stigma that prevents many people from seeking help, leaving millions suffering in silence. The Swahili word alika means to invite or welcome. Through our work, we invite people to access the support they need. We invite people and organizations to join our community. We invite the people and institutions of Kenya to think differently about mental health. We invite people and families struggling with mental health to come and heal with dignity.